On the 18th of December 2024, it was a case of Health Secretary Wes Streeting.
More on social care. Which taxes are you raising to provide more money for social care?
Versus newly Tory MP Joe Robertson.
This isn't me to do your job, Secretary of State. I'm asking you to justify your decisions.
As they had quite the healthcare clash during a Health and Social Care Committee meeting on the work of the Health and Social Care Department. Well, everything seemed to be going all hunky-dory with no drama. That was until our Tory Joe brought up national insurance contributions, and then it all got rather feisty.
I've got some questions on the national insurance contributions levied on employers in the budget. At the beginning of this session, you said health and social care is facing the worst crisis in history. In hindsight, do you think that's probably the wrong time to take 125 million from GPs, 50 million from pharmacists, 30 million from hospices and $1 billion from social care providers?
I'd say two things in response to that. Firstly, I don't accept those figures on the basis I haven't set out funding allocations for the year ahead. So we won't know the net impact one way or another until I've done that. And the second thing I'd say is we wouldn't have £26 billion for the Department of Health and Social Care without the political decision the Chancellor took in the budget. If people don't agree with raising employer national...
From the point of view of this committee, that's taking from with one hand and giving with the other. I mean, it's just going round in circles within the system. So from our committee's perspective, it's going back into a pot. Having taken from one, you're then going to give it back.
Even without having spelt out the financial allocations for different parts of health and social care, it is just obviously the case that the amount of money given to the Department for Health and Social Care dwarfs employer national insurance contributions from the health and social care sectors. Now, it's perfectly legitimate for people to say, I don't agree with the Chancellor raising employer national insurance contributions, but then you have to say, well, what are you going to cut in the NHS or social care in order to reverse that decision? Or where else are you going to raise £26 billion to avoid cuts to health and social care?
Do you know, it's such a crying shame that Layla Moran didn't carry on poking Wes Streeting on this, because I do think it would have been really, really interesting, and I'll let you know the reason why later on.
Just be clear, the 26 billion is not for health and social care, it's for the NHS. Those two terms are not interchangeable. GPs won't benefit from the £22 billion for day-to-day spending, nor will social care, nor will pharmacy and hospice, unless your announcement you make pledges money to GPs. Can you give any assurances that the money you've taken or will take from GPs, pharmacy, social care and hospice through national insurance will be returned to them?
My department has received £26 billion thanks to the decision taken by the Chancellor on employers' national insurance contributions. I'm taking into account the wide range of pressures that we inherited in health and social care when making allocations right across health and social care. But you can't on one hand say we love the investment and then criticise raising employer national insurance contributions. And if you do, you have to say, well, where are you going to cut, or where are you going to raise taxes alternatively?
You have pledged 26 billion to the NHS, 600 million, just 2.5% of that figure, to social care. So I do, with respect, think it's misleading to say 26 billion for health and social care. The vast majority, 98%, is for the NHS, which is not the same as health and social care. But can you give GPs
more on social care? Which taxes are you raising to provide more money for social care?
This isn't me to do your job, Secretary of State. I'm asking you to justify your decisions. Can you give assurances to health and social care providers that aren't the NHS, GPs, pharmacies, social care, hospices, that you will return the money you're taking from them through the budget, through national insurance contributions? Can you give them those assurances, possibly before Christmas?
I can definitely say across health and social care that we are better off thanks to the decisions the Chancellor took at the budget to invest in health and social care. We, as I've said very clearly, particularly in terms of primary care, in terms of hospices and so on, I understand people want to set their budgets for the year ahead. I'll be making my allocations in a timely way so people can plan for the year ahead.
When?
And should not be taking decisions, ahead of seeing the allocations, because I think, as I say, thanks to the heavy lifting the Chancellor did in the budget, we are in a much better position than we would otherwise have been had she not taken those decisions to both plug the black hole we walked into and to stabilise the public finances and to start fixing the foundations of our public services. People might not agree with employer national insurance contribution rises, fair enough, but what would you cut, or which other taxes would you raise? And those are legitimate questions for opposition
for GPs, pharmacy and hospices, we're talking about less than 250 million to return to them, which is a drop in the ocean for the Treasury. But a huge pressure on GPs. I would suggest that they're probably more likely to agree with me than you.
I'm definitely taking into account those pressures, but I'd say the drop in the ocean complacency that maybe contributed to the 22 billion.
Well, I think 250 million is a drop in the ocean for the Treasury, and certainly GPs, pharmacists and hospices would, I think, agree with me. Can I ask you about the Darzi report? So Darzi says to deliver hospital to community, treatment to prevention, you need to hardwire changes in the system by adjusting financial incentives. Do you agree with that?
Completely.
So how is it incentivising hospital to community and treatment to prevention by levying tax on community providers that you're not levying on acute trusts? How is that incentivising moving from acute to community?
You are making a whole set of assumptions ahead of me setting out financial allocations for the year ahead. And I come back to this central point, which I'm afraid you can't escape. You can't say, £26 billion, great, love the investment, but I really hate the way you're raising it, unless you are spelling out which services you would cut or which taxes you would raise as an alternative to employer national insurance contributions.
I'm saying return the money to healthcare providers instead of taking with one hand and giving to the other. But if we go back to hospital to community, you're giving some tantalising suggestions that there will be something coming down the road. And you're talking about in a timely way. A timely way from you and the department, for you and the department, might be a little different from healthcare providers. They need to know now. And I think you've acknowledged this, that they need to know in order to plan for the next tax year. Can you give any assurances? You told the BBC you might do it before Christmas. Well, let's start with that. Are you going to make an announcement in the next 4 working days before Christmas Day?
Well, I did say to hospices that we would make an announcement for Christmas. That's next week, and I intend to keep that promise. And then more broadly, I'm mindful of people needing to make decisions around their organisations for the year ahead. So I think we need to come to this early in the new year at the latest, and that's what we will do.
Can we take early in the new year to be January?
Early in the new year would be January.
Okay.
Now, it's such a crying shame that Layla didn't give Wes Streeting more of a hammering on this, because for the simple reason, as a Lib Dem MP, she doesn't quite have the same baggage that any Tory MP has, does she? Now, granted, he is one of the new 2024 Tory intake, but he's still a Tory, isn't he? And his party, they're in no position to tell anyone how to run anything after 14 years of Tory misrule and gruel, are they? Also, Wes Streeting, like him or loathe him, he can just throw back the, you like the more money on social care stuff, but you don't like where it's coming from line back at him, can't he? Now, rightly or wrongly, Joe Robertson ducked it, and for me, sort of like gave off that air of, Tories still don't have any policies on this, do they? They want all the trimmings, but they want none of the pain, do they? Now, that's the reason why I was gutted the Lib Dems didn't become the party of opposition. I wouldn't have even minded if it was SNP either, because they would have been taken more seriously than this band of brigands, wouldn't they? But what do you guys think? Let me know down below, and if you enjoy everything, House of Commons and Select Committee meetings, like and subscribe, and I shall just bid you farewell, and take care, my friends.